So as I start this video, I want to thank Dr. Kwiecien, who was the surgeon that did everything for me. And he's a great doctor. He takes his time. If you've got questions, which I always had a list of questions for him, which is excellent, especially when it comes to your health. You want to be able to have a doctor that you can talk to that will answer all your questions, obviously. So he did an excellent job. I also want to thank all those that from the Cleveland Clinic. I mean, it's a huge place. You go in there, people that help you navigate around. Any other people, anesthesiologists, nurses, you know, just everybody that's involved in the aspect of having surgery, and also the people working there that help you in this process.
He has like an early slacker, so it's like a narrowing of the radiocarpal joint, and you see a thinning of the joint line. He has like advanced carpal metacarpal joint arthritis here, and he also has like end-stage degenerative changes in the metacarpal phalangeal joints of the index and long finger. So that's a problem, but we will deal with it.
Yes.
Hey guys, I thought I would give you my impressions of carpal tunnel surgery that I'm having. This is my right hand. I'm going to be having one here in a couple weeks on my left. And just thought I would see what's going on, what I encountered with the surgery, and how it went. So I was originally supposed to have surgery on my right hand Monday, November 20th of 23. Actually went out there to the Cleveland Clinic, quite a ways from the house. And unbeknownst to me, the surgery was canceled. I wasn't notified, and it was canceled because the anesthesiologist wanted a test done. And so I was able to get that test the very next day at another Cleveland clinic. They have a whole bunch of buildings. And so then it was rescheduled for yesterday, which was Tuesday, November 21st of 23. Now, as I do this, we're not even 24 hours out after surgery. Probably about 23 hours, because I think it was around noon or so that I actually went into surgery. Obviously, you're prepped and everything beforehand. So I'm going to tell you what I had done and what they did to do the surgery. So they did two different procedures. One was carpal tunnel surgery. And the definition, what that is, carpal tunnel syndrome is a common neurological disorder that occurs when the median nerve, which runs from your forearm into your palm of your hand, becomes pressed or squeezed at the wrist. You may feel numbness, weakness, pain in your hand and wrist, and your fingers may become swollen and useless. And I've had this for some time, and it really started ramping up, and it got to the point where I ended up going to the emergency room in June of this year because this arm just got totally numb, and it was just terrible. So fast forward, Cleveland Clinic, and after tests and everything, they showed that I did have the carpal tunnel, and so that's what brought me to this surgery. Now, the other thing that they did was called denervation surgery, and that is Denervation. And denervation is a loss of nerve supply. Causes of denervation include disease, chemical toxicity, physical injury, or intentional surgical interruption of a nerve. And that's what they did with me. They intentionally surgically interrupted a nerve. And so that was done to help alleviate my arthritis that I have in both of my hands. So both of my wrists, both hands, both thumbs where they come in here, and my knuckles, and I think a few joints in here are bone on bone. And so the doctor said that this may help to alleviate the pain from that arthritis and what he ended up doing. I know he said that he cut the couple nerves up here, and he also, I believe he also said he cut one going to the thumb area. So those are the two procedures that I had done yesterday at the Cleveland Clinic, as I stated, November 21st of 23. Now, I want to tell you what they did prepping me. Obviously, you go in there, and the first thing they did is, they give you the IV and talk to you, ask questions and whatnot. Then they sent me to another room where a doctor said they were going to give me a nerve block. I believe there might be a technical medical different term, but it was basically a nerve block for my right hand. And this is actually where the doctor wrote something on my arm as we were talking prior to surgery. He wrote something here, and then up in here made some marks. But and so what they did, here's how they did it. Quite interesting. Under my right armpit, being this is the right hand, they clean the area up, and then they do they have to check and find where the area that they're going to inject whatever they inject in there to block pain to this arm. And I was told that that is for after surgery, more or less for pain management after surgery. So what they do is an ultrasound. They actually do an ultrasound up under my armpit there, my right side, and then they find the areas that they're going to inject this, and you feel like a bee sting, and they keep that in there a while. They move the thing around, whatever they have to do, and believe me, when they're done, it doesn't take long for this arm to get numb. And this is prior to even going to the surgery room, and I asked her, why don't they just do this in surgery? She said they want to make sure that the patient is awake so they can monitor them, and they do hook you up to a heart, you're checking your heart and also your oxygen level. So I have to say, as you can see, they did a really nice job of wrapping this. I didn't know it was going to be quite this exotic. I mean, they've got some kind of a board under here, it's stiff, and they've really got it wrapped up nice. And so when I came to, the doctor was still just finishing up the wrapping, and this arm, the worst part about this whole surgery was the arm that they numbed. This being about 24 hours later, I feel fine. Obviously, when I go like this, I can feel some, not really pain, but something happened. And you're not supposed to lift or push or anything with this hand, but I feel fine. And the biggest thing I had was the numbness. You go home in a sling, again, because of the fact that they did this block. Now, the average person, if they don't do this block, you don't need that. But because I had no control of this hand, literally, it would flop right down. It's like it was dead, like it was paralyzed. And so it wasn't until about 9:30 last night that I mean, you can't even move your fingers. You're like trying to force to move them, and they're not moving. It's a hell of a feeling. About 9:30, I was just able to very slight motion. I thought, this is good. And then my fingers got real warm. I was a little concerned because, obviously my left hand had a certain temperature. These felt very warm. Now they're back to, normal. But so I wasn't sure what was up with that. But then around 1:30, I noticed more movement, and I still had the effects. You could still feel some paralyzation or numbing, and now it's fine. So like I said, the worst part of this surgery was, in fact, that block, the after effect. So when I have my follow-up next week with the doctor, I'm going to ask him whether this is something that, because like I said, I was told, if I understand correctly, This is strictly for the after, because the doctor said it was a lady doctor. She said, they don't know what your tolerance to pain is. So, anyways, that's why I said, well, go ahead and do it. I wasn't going to second guess them. Look how well they did that. Ain't that amazing? Quite amazing. I'm just really, they did a beautiful job of mummifying my hand there and getting, and you cannot get this wet. You want to make sure this stays dry. Doctor said if you get this wet, it must be replaced. And they've got to do it, obviously, to do it correctly. So next I want to talk about the prescriptions that I was given. And there are 3 of them. One was, and I'll spell it, CEFADROXIL 500 milligrams. And it says that is used to treat bacterial infections in many different parts of the body. It belongs to a class of medicines known as, I'll spell it, CEPHALOSPORIN, antibiotics, and is a strong antibiotic. It works by killing bacteria or preventing their growth. However, this medicine will not work for colds, flu, or other virus infections. The second one was, and I'll spell this, ONDANSETRON. Then the next part is in caps, HCl 4 milligrams. This medication is used alone or with other medications to prevent nausea and vomiting caused by cancer drug treatment, parentheses, chemotherapy and radiation therapy. It is also used to prevent and treat nausea and vomiting after surgery. It works by blocking one of the body's natural substances, serotonin, that causes vomiting. Now, this morning, I did take one of those. I hadn't really looked what it was for. I just took it. It said take as needed. But I don't have any nausea, none at all. And that last pill that I talked about, you take 2 a day, one in the morning, one at night. That last pill that I just mentioned, the CEFADROXIL. But this current medicine, the ONDANSETRON, I took one this morning. Then after I saw what it was for, I thought, well, I don't need it, and I won't be taking any more. And the third and last medication that I was prescribed was oxycodone, OXYCODONE, and then in caps HCl, and then in parentheses IR, in the parentheses, and then it's 5 milligrams. This is a prescription drug that's used in adults to manage pain that's severe enough to need an opioid medication. Oxycodone IR oral tablets are used with non-opioid pain treatments that haven't worked well enough or can't be taken. Now, to be clear, I didn't even take this. As I said, I really don't have any pain. Perhaps a little discomfort, because it doesn't feel quite the same as your normal hand did. But you had surgery, so that's to be expected. So like I said, and they did give 15 pills. This was given 15 pills, and you take them 1 every 8 hours as needed. So like I said, this is something that I have no desire to take, and I did not take any, and will not need any. Like I said, I was very surprised that the pain after the surgery was 0, really. The biggest discomfort that I had was the arm being numb. That was the worst part of the whole process. And those 5 milligram oxycodone pills are very small. So if anything changes, I will update as I go along. Next week, I see the doctor. He'll take the bandage off, and I'm slated to have my left hand done on December the 5th of 23. And we'll take a look at what the incisions look like. He used those dissolving, what do you call it? Those dissolving stitches. So Like I said, we'll see what this looks like and how I get along each day here. If something changes, I will update the video. Today, guys, is Friday, November the 24th, 2023. And I had my surgery on Tuesday, the 21st. And something I noticed this morning is I can straighten my hand out, my fingers, all the way, as you can see here. Where before I was limited, somewhat like this. And if the pain was really bad and numb, then it was even less that I could open it. You know, maybe something like this. But like I said, this morning, I'm open. In fact, I'm stretching them. It might be better, you know, they're nice and straight. So that's good. And I'm feeling good. Obviously, if I do some pressure, this and that, I can feel some stuff, but you're not supposed to lift. So I just thought I'd mention that. Real happy about the progress here. Now here's my left hand, and they're going to be doing the same surgery on it. And if you can see, well, my little finger there is curved. I can't straighten it. And then if you take a look at my middle finger, if you can see it's crooked, you can see it goes, then it goes down, and then kind of back up. Maybe you can see it better there. So, but like I said, they're going to be doing this. It's slated for December the 5th. And I go back to the doctor for my hand, for the right hand, to get the wrap off, I believe next Wednesday. Alright guys, so today is the afternoon of December 6th, 2023, and yesterday I had my carpal tunnel surgery on the 5th of December on my left hand, and so they also took my wrap off of my right hand, and I had surgery on this hand on Tuesday, November 21st. So this would actually be 15 days later that this is the outcome, and this is what it looks like. This is the carpal tunnel surgery, and then over here is the denervation surgery they did, cutting some nerves that, as I recall, the doctor said that would go to the thumb area and then up in the fingers for the arthritis. Now the doctor did use those self-dissolving stitches, but he said it would take a few weeks to fully dissolve. Now obviously we're only talking 15 days since my last surgery on the right hand, but it's I can make a fist like that. It really doesn't hurt too much. I don't know that I have the full power yet, but I can do that without any pain. Now it kind of hurts when I do that, and when I go up it's not bad, but when I open up my fingers and go back it hurts. But again, we're just talking 15 days after this surgery, so that's not all that bad. And then in here is where they did my IV for yesterday's surgery on my left hand. So actually not too bad, really. And then here's my left hand that they just did yesterday with the wrap. Now the doctor didn't do the denervation surgery, as he said that this wasn't as bad. Obviously they did the carpal tunnel, but he said he recommended not doing denervation on the left side One of the reasons being, which makes sense, he said it wasn't bad enough, and he said that anytime we do surgery, we can make things worse. So he said, he didn't want to have something where you come back and say, hey, this is worse than what I had. So I said, yeah, that's fine. So we just did the carpal tunnel yesterday. Now, something that I wanted to do was protect this, because I'm only able to lift for the next 2 weeks once the wrap is off, 5 pounds. And so, and obviously with this hand, they recommend nothing for 2 weeks. And again, when the wrap comes off, 5 pounds for the following 2 weeks. And so I wanted to protect this because I bumped this, and man, it was sore. So I got all different kind of gloves, and these were a pair I think I bought last year. I don't know, on sale something, and I just bought them to have. You never know, you need. I've got multiple different kinds, but these I hadn't worn. I thought, well, these would be a fairly decent pair just to put on. And when I was driving today, I put these on, and it does offer protection. So when you're bumping something, you're not gonna affect that area that's, that the stitches are in, that's been cut. So that would be one of my recommendations, is ahead of time have some kind of a glove to protect your site, the surgery site there, because as you know, you're always using this. If you're doing anything, you're going to bump that, and believe me, it hurt. So, and I don't want to do anything to have any issues. So that again, that's a recommendation. Ahead of time, maybe get a glove in anticipation for protection of your hand. All right, guys, it is the winter, and if you live in an area where you get snow and it's cold, like I do, another consideration that I didn't really think of, because I didn't know these are going to be this damn big, this wrap. And so all my jackets, my Carhartts and various jackets, which I have quite a few different ones, they were too snug to go around this mask right here. So luckily, I got this one from, this is a Dickies, got it at Walmart. So something to think about is when it's cold, if you're having the surgery in the winter and you've got to have a jacket, make sure you get something that the cuff opens up completely like this does. The ones that are knit, that are tight and you got to put over, are very hard to put over. I don't even try them. And so this cuff opens up, as you can see. The arm's big enough, I can get this through, and I can get it through here, and I just leave it unbuttoned. So again, this isn't something that I thought of until I had my right hand done. I was expecting just a small bandage. I didn't know it was going to be like this. So just something to think about in preparation prior to your surgery, making sure you have something in a jacket to stay warm in the winter that will in fact go over your wrap, and something that I hadn't thought of originally, because again, I didn't know it was going to be to this extent. Alright, so today is December the 12th. It's a Tuesday, 2023, and it is 3 weeks out from having my right hand carpal tunnel surgery and denervation surgery, and it's 1 week out of the wrap that it was in. So here's a close-up area where the denervation surgery was done. And here we see the area where the carpal tunnel was done. Now if I take my hand, rest it on this countertop here, and kind of push on it, I can feel that area. It feels strange. Again, it just, I don't know how to describe it. but you can feel it. You know what I mean? You can just sense that area when you push down on it. Now, as to the denervation surgery, what's interesting is if I push here, right here, it just feels numb. It feels strange versus pushing here. You push here, it has a certain sensation. Right when you get here, I don't know, it almost feels like it's numb. Like you feel it, but it's not the same. It's almost numbed. Same here. Right in this area right here, the most. Okay, so here it's got normal sensations when you touch your skin. Right in here, it just feels thick. It feels like it's numbed. Another thing I notice, and I've got to find out from the doctor what this thing is, I forgot, but it's more pronounced after surgery, that bump. But I go there on the 20th here, in 8 days. I will go and I'm going to find out what that's called. But since that surgery, this is much more pronounced. And he did say he could operate on that, but he said I'd lose wrist motion. And he said it was about a 3-month recovery, healing. And I said, well, I don't want to lose any wrist motion, so I just said, let's not do that. And then today marks 1 week after my right hand carpal tunnel surgery. Now, being left-handed, if I try to hold a pen and write, I can, but then this area in here where my thumb is kind of hurts. So again, we're just talking 1 week out. But other than that, no negative effects. Just not doing any really lifting with it, keeping this area dry. And also the doctor said that this area for the next 2 weeks, which would be now a week from today, he said indirect water splatter is fine, but it cannot be soaked. Today is Tuesday, December the 19th, 2023, and today marks 4 weeks since my carpal tunnel and denervation surgery, and I can see a major difference here in just even just the last week. And today was the first day. The doctor said on the 5th, when he did the surgery on my left hand, and they took the wrap off of this one, 2 weeks to get it wet. So today was the first time I actually got it soaked. He said indirect water was fine, but other than that, direct soaking. So, and it was starting to get dried out. My hand was starting to get dried out, because to clean the areas here, what I was doing was using alcohol, isopropyl alcohol, in a spray bottle, to keep the area clean. So tomorrow, which is Wednesday the 20th, I go back to see the doctor, and he'll take this wrap off. And then I'll have 2 weeks after that to get it soaked with water. So here you see a close-up of the incision made for the carpal tunnel surgery. And it looks like there might be just one little, what you call it there, stitch. Maybe one there, but it looks like all the stitches have dissolved at this point. And you can see there's just a slight, looks like just the layer of skin that needs to be healed back. So that's really good. And one thing, a buddy of mine, he had surgery like this a year ago, carpal tunnel, and apparently they took the stitches out. I wanted the dissolving, but they took stitches out in a week, and I guess he said his, I don't know if it was a few days, I forget exactly, and he said it actually opened back up. So I'm so glad that I waited, and the doctor, we did the way we did it, because I'm real happy with the result here of this incision and the way it looks. And then here we see the area that the denervation surgery was done. The lighting seems strange. I don't know if my skin's... The lighting here that I'm using may give kind of a bluish purple cast. I don't know. From looking here back in the viewfinder and then looking without the viewfinder. So that's just, I don't know, the lighting and something. But it looks, I mean, this is unbelievable how it's healed. I mean, this is amazing. And I have to say, it's so much nicer because, again, I can't get this wrap wet at all. And the doctor wanting this without any direct soaking water for 2 weeks, it really makes it a chore to maintain. But I did it, and I'm so glad. But because it just limits you on what you can do. You can't get your hands real dirty, can't get them greasy, can't work on anything too much. But so when I was able to get this wet today, it was a major thing. So tomorrow we get this off. We'll see how this is healing and see what the doctor has to say about it. And then 2 weeks after that. So that should put me into about the 3rd of January, where I can get this hand wet of 2024. Something else that I did here in anticipation when I was getting the right hand done is this is the mouse that I use. I like this mouse. It's a Microsoft mouse. Probably the only thing from Microsoft I'll ever give credit to, other than their damn operating systems. But what I like about it is the way your hand lies. You can use it nice. And so I'm used to a mouse like this, not those little small flat ones. Well, my thought was I'm going to be hindered with having a wrap like that on my right hand, so I went out and bought a left-handed mouse. Yes, they actually make a left-handed mouse. And so it was only like $20 off Amazon, and I never used it, never had to use it. Even the next day after surgery, I was still able, even with that, to use this, being careful. It was no issue using the mouse. So I don't know if anybody else has got that idea that they would need to get a left-handed mouse. Probably save your $20 because I didn't need it. Today is Thursday, December the 21st, 2023. And yesterday, on the 20th, I had the wrap taken off my left hand. And I actually think this looks better at 2 weeks than my my right hand did. There you see some of the stitches in there that will dissolve. But the doctor was very pleased, as am I. Now I did ask the doctor, and he says they do go deep with this cut. And on my right hand, this basically is 4 weeks from surgery, and it's all but healed. There's just some outer skin here, and he gave me some stuff to put on it, as well as he told me to put up on here. But it's looking excellent. And for a deep cut in 4 weeks, that's really good. Now as to my left hand, I still have to not get it soaked. I can get water spray on it, but not let it get soaked with water for 2 more weeks. And he said just in case something would get in there and cause an infection. Now one thing I do want to address is some people might be saying, well, how come you had surgery 2 weeks later? Right hand, and then 2 weeks after that you had your left hand. Well, on November the 10th I had my pre-anesthesia. That was a Friday. Surgery was to be scheduled the following Monday on the 13th. Well, that got canceled because of a reason. And so since that got canceled, it was rescheduled then for the following week on a Tuesday, the 21st. And then I told the doctor, I said that, of course, he knew I wanted to get this all done by the end of the year, so I didn't have to pay my extra, as it went into next in 2024, my deductible. But I also told him, for whatever reason, the pre-anesthesia at the Cleveland Clinic, if 30 days it goes past, you've got to do another pre-anesthesia checkup. And to me, that's foolish, driving that distance all the way to the Cleveland Clinic for something you just did maybe 40 days earlier. And I don't know if that's just their policy. Obviously, their policy, if it's state policy, I don't know. So that's one reason why, because of the fact that now we moved it to the 21st, if he would have waited, 3 weeks from the 21st or so, even to compress time, we would have gotten into then where we would have gotten past the time frame there of the 30 days. So he said he would do that for me. So that explains why he did it in just 2 weeks. When I talked to him yesterday, he said, yeah, you're doing fine. He said most people wouldn't do so well, but since I'm active and whatnot and just decent shape, I guess, he just said that that was fine, that I was doing good. Now, another thing that I addressed with him yesterday was I've had this thing up here on my right hand, that bump, and he said it's called synovitis, synovitis, and it's an inflammation of the tendons. And I told him that it's more pronounced even now. Doesn't really hurt, just more pronounced. And he said that it's just inflamed more. And he said, just keep using your hand, because like I said, I'm still having, it's still kind of sore here. I mean, pushing on it and stuff. But he said I can go ahead and use my hand. But he said just keep moving your hands. But he said that should go down. He said I also could put some compression on it. But he said if it caused me any issues, he says, because I don't want surgery on it, because he said he could operate, but then he said you could lose motion in your wrist, which he said I already have loss of motion, and plus the recuperation time, he said, is like, I believe he said 3 months. So, I'm just going to live with it. He said if I had pain, he said they could inject that area. So that don't sound good to me either. But anyways, so other than that, everything, I'm real happy with the way things are going. Today is Tuesday, December the 26th, 2023, and it is 5 weeks out since I had surgery on my right hand, the denervation and carpal tunnel, and it's 3 weeks out for the carpal tunnel on my left hand. And it's really looking good here on the right hand. And then here you have the denervation surgery area. Healing up really good. And then the left hand, where they did the carpal tunnel, you can see those stitches, which are, like I stated before, dissolving. They're still in there. You can't pull them out. So I'm just going to let them go as they do. But it's coming along really good too, I feel. Alright guys, today is Tuesday, January 2nd, 2024. And this is my right hand, and it has been 6 weeks since I had the carpal tunnel surgery and the denervation surgery. So here's a close-up of the area that was done with the denervation surgery. Healing up really good. It's still, and again, it's probably just, I don't know what they call it, scar tissue, but or healing process still, but a little bit hard in this area. And if I do something that tends to pull like this, up do something that tends to pull kind of hurts a little bit. But again, we're just 6 weeks out from surgery. And here you see the actual area where they did the incision for the carpal tunnel. Now, since about Wednesday, last week, about December 27th, 2023, started to have an issue. Not quite sure what it is, but if you follow up, like right in here, okay, this area, these two fingers will tingle. And I don't know how to say it, the sensation's different. You know, when you push on your fingertips and fingers, there's really no sensation other than just the feel of your fingers making contact. Okay, thumb area also. But here, well, it's like I said, there's something going on. Sometimes it's a little worse. Sometimes it gets real bad. At the moment I'm doing this, it's just a slight tingle, a different feeling. And you can, nothing there, and just as you come over in this area, this part of the hand. So I do have an appointment coming up in a couple days, this Thursday the 4th. I called the office and going to go in there and see what that might be all about. And here is the left hand, which is 4 weeks out. So this is 4 weeks since I had the carpal tunnel, and as you recall, I had no denervation surgery done on this side. Looking real good. Today is Tuesday, January 9, 2024. It's been 7 weeks since I had my right hand carpal tunnel and denervation, and 5 weeks since I've had my left hand carpal tunnel surgery. Now, I did make a mistake in my last series that I did of clips for January 2nd. I had stated that the numbness that I was getting here, actually this started, the last time I saw my doctor, appointment follow-up, was December 20th of 23, and it was a couple days after that that I had gotten this numbness here that I was talking about, this different feeling in here. And so I waited a while because I didn't want to, just see what was going to happen. So then I had an appointment for January the 4th, which was a Thursday. That got canceled the day before because the doctor was sick. So the follow-up for this issue now, this numbness, whatever that might be, which I still have, is going to be scheduled now for the 15th of January, which is a Monday. Today is January the 16th, 2024. It's been 8 weeks for my right hand, carpal tunnel and denervation, and it has been 6 weeks for my left hand. Now, yesterday, on Monday the 15th, I had an appointment to see the doctor, and the first thing he wanted to know, because it was about this numbness in these two fingers, so the first thing he wanted to know is what fingers were they. And when I told him, he knew right away what the culprit was, and he had said that it was not from the surgery, from the denervation, nor the carpal tunnel. So he said it was from this cubital tunnel syndrome, which is in the elbow, this nerve in the elbow. And You can freeze this frame and read for yourself. So he prescribed these to me and said this should take care of it. And then you would take these as prescribed. On the I'll show you on the other side. They tell you how to take these. So this is somewhat like a Z-Pack, but I think it's for something a little bit different. The way what this acts on, and that I'm not sure of. My next visit with the doctor at the Cleveland Clinic will be Wednesday, February the 21st, 2024. And because as we approach the beginning of March, about March 4th or so, will be the 90 days since the surgeries. And they give you 90 days on each hand, free follow-up as part of their program, where they don't charge the insurance. Okay, so today is Tuesday, January the 23rd, 2024, and it has been 9 weeks since my right hand surgery and 7 weeks since my left hand surgery. As to the numbness in my right hand, these two fingers, that has not gone away, and I still have it. So not sure what's going on with that, but so this medication actually didn't do too much for me in this case. So today is Tuesday, January the 30th, 2024. It's been 10 weeks for the carpal tunnel surgery on my right hand and the denervation surgery, and 8 weeks on my left hand for the carpal tunnel surgery. Today, guys, is February the 13th, 2024. It has been 12 weeks since my right hand, along with the denervation surgery, and 10 weeks on my left hand. Now, I didn't do one last week at 11 weeks, or the 9 weeks, because we're getting far out and things are looking so much better, so I thought I would skip that week. Now, I've still got sensitivity here. You can't push down on this. If you want to close a lid that's hard and you use the palm of your hand to push down, it's still very sensitive in here. Today is Wednesday, February the 21st, 2024. Yesterday was 13 weeks on my right hand and 11 weeks on my left hand. And so today I saw Dr. Kwiecien for the last time on my post-op surgery. And so this will be the ending of my series. And so as to the carpal tunnel issues that I had, and as to the surgery, everything's coming along. Everything's good. The doctor says it'll, take a while before, because like I said, it's still sensitive in here, where that incision line is on both hands. But I've been very happy, so glad that I did get that surgery, because it was in fact required. I've not had any issues pertaining to the carpal tunnel since. And guys, this video has been approved for all ages by the Moose. What's up, Moose? She's not saying much tonight.